Erica Wheeler, ladies and gentlemen, if I can introduce her for a moment. She is the central figure in WHO in Geneva on all the items that we've heard already about this morning. So if you deal with WHO, Erica is the person that you want to be in touch with. And she manages a team there that is able to prioritize the whole HRH challenge worldwide within the overall global agenda of WHO. So Erica, if you would be able to share with us your presentation in the next 20 minutes, we would very much appreciate it. Over to you.
Thank you very much, Og, and good morning to you. It's afternoon here, and it's a very sunny Geneva. So I am going to talk to you, as Og said, about the work that we've been doing in WHO in the newly reformed Department of Health Workforce on education, specifically looking at the work we've been doing on transforming and scaling up health workforce education. And listening to Estelle, just to say Estelle has been very much a part of the work that we've been doing, both on this as well as on the issues of retaining health workers in rural and remote areas. So that's what I will be speaking to you about this afternoon. I understand someone is going to be doing the slides, so I'm depending on you on that end to support me with this. So I'll just go to the second slide, which looks at the purpose of the presentation. And what I want to start by doing is to describe the context in which these policy recommendations on transforming and scaling up health workforce education and also looking at retention, the context in which they were developed, some of the challenges we faced, a little about WHO's response, because, you know, WHO as the global health organization has a normative role. And thirdly, look at some of the key policy issues and recommendations. I will only touch very briefly on some of the follow-up work because I understand that I've got 20 minutes, so I guess there would be time for questions. So moving on to the next slide then. I want to just give you an idea, starting from 2006 going forward, as you see on this slide, to 2013. This is the framework in which WHO is conducting much of its normative work on education and on health workers in rural and remote areas. We, as a global normative organization, we are guided very much by member states, 194 member states. And what you would see on this slide is the various World Health Assembly resolutions that guide our work on education of health workers. And you would see in particular the ones I've highlighted in red there. So 2006 was a very important year for us, starting with the World Health Report, Working Together for Health. And on the basis of the evidence gathered from that work, if we look on the next slide, you would see that this is a slide that I know so well. I sleep it, I eat it, I drink it. It's on page 42 of the World Health Report of 2006. It looks at what we call the education pipeline. And really the idea behind this is looking at who comes into the health workforce from the very beginning. So in the pre-service aspect, we look at the pool of eligibles, and I'll say the pool of eligibles are really people coming in from secondary school, but also from other sectors who want to be trained as health workforce. So they're selected, courses are accredited, they go through training institutions, they graduate, and they become health professionals. But we see that there's attrition along the way. And, of course, we have important issues of licensing and then recruitment. So this education pipeline was something that we began with. But we have gone very much beyond this as I speak. But I wanted to show this before I go on to the next slide, to get fixed in your mind. This is the basis from which we more or less started the work that we've been doing over the last 7 years. So on the next slide, this again is from the World Health Report, and it shows the forces that are driving the health workforce. And I thought it was important to show this because it shows the relationship between the forces that drive the health workforce that fits in very much with what Estelle was talking about, the education system and the health system, looking at what are some of the key issues that the evidence showed that makes a difference. So we see under the driving forces, obviously, their health needs, their health. Then there's the health system. We look at financing, technology. Estelle mentioned, a bit about technology. I didn't hear Kate, but I'm sure Kate would have mentioned something about that as well as the context. Very important, talking about the labor market and education and public sector reforms and globalization. And the challenges then for the workforce, they have remained essentially the same. I think it is a matter of degree, but we see here numbers, skill mix, distribution, and working conditions. And those two orange boxes that you see to the right of your screen, essentially the guidelines on access to health workers in rural and remote areas that I'm sure was mentioned already, we published back in 2010, and I'll say a few words about those guidelines, how they relate to health worker education. And the guidelines on transforming and scaling up education and training of health professionals was published. It was launched in Recife last year in Brazil at the Third Global Forum. And USAID was very much a part of this work and supported us, and PEPFAR also was very much involved in the work that we were doing on this. So we've been working together quite closely on these recommendations that were published last year because they are, after all, global recommendations. So on to the next slide. Just to say a word about the guidelines that I just mentioned on retention. When you look at that slide, you would see that the categories of intervention does, in fact, mention education as one of the key critical areas of intervention when we look at retention of health workers in rural and remote areas. And we see there's also regulation, which is an aspect of the work also on education, financial incentives, again, a part of what we looked at when we did the recommendations, as well as professional and personal support. So the next slide then shows you what are the education-related policy recommendations that were contained within these policy recommendations published in 2010 concerning access to health workers in remote and rural areas. And as you can see on this slide, the areas highlighted in yellow address directly the education-related policy recommendations. So it shows you immediately that when we talk about one area, we cannot discuss education in a vacuum. It has to be related, and I'm sure this was mentioned previously, it has to be related to other areas. Health does not stand on itself. So when we talk about health professional education, we did look at areas of particular and critical importance because we know issues of access to health workers in remote and rural areas were important. So this was highlighted. And again, I already mentioned issues of labor market, which is critical. So the areas under education, just to mention them briefly, recommendations were made about students from rural backgrounds, about where health professional schools should be placed, i.e. outside major cities, about clinical rotations in rural areas during the course of study, and many universities are now really in the throes of doing this kind of work. We know about many in the Philippines, in North America, that's doing this work. Curricula that reflect rural health issues, very critical, and continuous professional development for rural health workers, especially because of their isolation. And, of course, issues of subsidizing education for return of service. So let's look at the next slide. And just to come back to these recommendations, because I mentioned earlier that WHO as a normative organization that has a global mandate, we, building on the work of the Lancet Commission that Estelle spoke about. It was a seminal piece of work. We took these into consideration along with the resolutions, the directives given by our member states. So what is this transforming and scaling up education and training of health professionals, and what were the recommendations? So the idea was we addressed the expansion and reform of health professional education, because there has been a sea change and a recognition that something needs to change. We can't continue business as usual if we want to have if we want to give health professionals different skills. It is what you put in, what you get out of the other end. So we are talking about the expansion and reform of health professional education and training to increase the quantity, quality, and relevance. And these three parameters were particularly important, and we put them together in a way that had not been done before. So looking at quantity, quality, and relevance of health professionals to meet population health needs and expectations, and to strengthen countries' health systems and improve population health outcomes. So this was the objective then. So I want to give you the picture that diagram that I showed, going from working together for health from 2006 and up to 2013, and we're now in 2014, that it is part of a continuum. It's not something that's done in isolation, and it's done working with our partners in different parts of the world. So the next slide shows you who those consultations were done with. They were done, I don't know how well you can see the slide, but certainly we looked at all of the stakeholders. We looked at national authorities, we looked at regulatory bodies, professional associations, health services, educational institutions, but we also looked at the community. We had, civil society representation as well, and of course, naturally, with development partners, because development partners support countries, and everything we do is aimed at improving health outcomes at the country level. So this is why you see the arrow at the end says population health outcomes, because that is our business. That is what we do and what we're concerned about. So when we make policies, this is the objective. And behind this, it says surveys in the title. We also conducted a feasibility and acceptability survey. So we took all of the proposed interventions made in the recommendations, and we tested them at the country level with these groups that you see here in the bubbles, people representing these different constituencies. So the next slide, which shows briefly the recommendations before I flash them up in a bit more length. We have the recommendations that cover faculty development. In fact, there are three recommendations. Curriculum development that I heard mentioned before. This is an area that Estelle said they've been working in many years. We've taken this and we have a recommendation on it. We have simulation methods, direct entry of graduates. And when we say direct entry of graduates, we're not just talking about direct entry midwifery. We're talking across the board, direct entry of graduates. We looked at admissions procedures because naturally if you want to talk about what happens with outcomes and the kinds of health professionals that you train, you have to look at the criteria for admission of health professionals, that pool of eligibles, that group there. We made a recommendation on streamlined educational pathways and ladder programs. So what happens to health professionals? We made a recommendation once they're in the system. But we also touched on instructional design, interprofessional education as one recommendation, accreditation as critical because in some countries, as we did the research, and as many of you know, that not all courses are accredited, and the result of that is that it makes it very difficult for health workers to be employed once they graduate, and continuous professional development. So if we look at the next slide, just to give you a very brief idea, because I have a slide that would probably take 10 minutes to describe how the evidence was measured and how we decide in WHO on strength of recommendations. But essentially, we can look at it as the quality of the evidence related to the strength of the recommendations. And we use something called grade methodology, which is globally recognized, and it is something that we have to do in WHO. We have to be very rigorous and systematic in our approach, and the quality of the evidence is graded, as you can see there, from very low to high. And that does not mean that maybe something is not desirable. It just talks about the quality of the published evidence. And we compare that then with the strength of the recommendation. So it is possible to have a recommendation that is strong with evidence that's moderate. And this is not at all uncommon, especially in policy recommendations where you're not dealing with, how many pills you need to take, how many times a day. We're dealing with policy issues. So the strength of the recommendations then, we have a panel that decides on the recommendation. It's a long and rigorous process. And at the end of it, we have levels of strength which could be listed as strong, which means it can be adopted in most situations, or conditional, which really means that we need a lot of stakeholder involvement. Not that we don't need it in the strong recommendation, but when it's conditional, because it means the quality of the evidence is not as high as it could be, there's even more need for that stakeholder involvement in deciding the way forward, because countries have to prioritize. So we look at the next slide. How am I doing for time, Ok? No, you can't.
Still doing
okay.
fine. I would
Okay.
think you have another 5 minutes or so.
Okay. So just quickly, if you see the next slide on recommendations, faculty development, I won't read through all of them because it will take too long. But you would see that we have 3 recommendations on faculty development. The first one is essentially on designing and implementing continuous professional development programs for faculty and teaching staff, because the idea is if the faculty and the teaching staff are not transformed, they themselves cannot teach the kinds of, deliver the kind of curriculum that's needed to transform the education of health professionals. And secondly, that we need to support and implement higher education policies, because again, this is what drives change at the national level. And thirdly, looking at considering innovative expansion of faculty, because in many countries there are such stringent requirements put on who should become faculty that the issue of shortages is so expanding faculty is so difficult. So we are recommending that there should be an innovative expansion of faculty, and we're not talking about lowering standards at all here. And the next slide, which looks at many other areas, and the ones that I mentioned before, curriculum development, simulation, and direct entry. You would see that we've made recommendations on each of those areas. And I just want to move to the next slide because I know time is of the essence. I just want to deal for a minute on admission procedures, because I mentioned this before. On admission procedures, what we recommended here was that education and training institutions should consider using targeted admissions policies to increase the socioeconomic, ethnic, and geographical diversity of students. There's a lot of evidence that shows if you train in a rural area, that the tendency is for people to remain there. But we need broader types of evidence on admissions, especially going back to what I mentioned about having access to health workers in remote and rural areas. We need to look at issues of ethnicity, for example, that's critical. So when we look at recruitment, we should not think only of the remote and rural areas, which are important, but what about, for example, peri-urban areas or slum areas? So we need to look at a variety of issues and competencies when we talk about admissions procedures. And in fact, I'm working very closely now with UNESCO to look at the curriculum in secondary education, because if you want to transform health professionals, you don't wait until they're already in the system. You have to look at their education even before they enter the system. And UNESCO has already started doing quite interesting work at the curriculum of secondary students and looking at the link between secondary and tertiary education. So I just wanted to emphasize that. Accreditation and CPD, I won't dwell too long on this because this is something that I think is pretty well known. about accreditation, the need for accrediting courses at especially in situations where there's a proliferation of private schools at the country level, and of course continuous professional development for health professionals. So just quickly then to mention the 4 good practice recommendations and to say what I mean by good practice. This really means that if we want to bring about changes at the level of educational training institutions, we need to have political commitment. We cannot do it without political commitment. Otherwise, it will be piecemeal and fragmented and driven by individuals. And we also need to make sure that there is collaboration between the different ministries, because we know if the Ministry of Finance says no, it doesn't matter how innovative or how forward-thinking you are, things don't happen. So we need to look at, the education, health, but also take other ministries on board with us. It has to be, and there needs to be planning. It needs to be part of the national plan, not something that's kind of added on at the end and tucked away. And we need to create or strengthen national and subnational institutions to support this implementation and reform, if necessary, through legislation, policies, and procedures. And just to say that when we look at some of 2 in particular of the areas for continued research coming out of the recommendations on transforming health workers and looking at the issues of rural and remote areas, there were 2 key issues that were picked up on, and which was asking if changes in recruitment have an impact on retention of health workers in underserved, poor, isolated or rural zones. And there was a call for longitudinal studies here and looking at what is the impact of decentralizing education and training programs on rural recruitment and retention. And here we were saying we need assessment of the impact of decentralizing education and training programs. So my very last slide here is just to say that WHO has already, and I have to say that when I say already, we don't do it on our own. WHO works with partners. We work with countries very closely. Our mandate is to work with ministries of health, but we work with a variety of partners, both within WHO, for example, the Alliance, the Global Health Workforce Alliance, but we work with our partners all over the world outside WHO, and we couldn't do it without them. So we've started looking at a number of areas. We're working with NEPI and MEPI and the ARC, the African Regulatory Collaborative. We have developed an e-platform. We are working internally in WHO with other programs. We've started policy dialogues. We are working with civil society. And there is that research agenda which I did mention. And so I'm on my last slide, and I hope I'm not too far over time. And this just gives you the 2 websites where you can find information, one on the guidelines themselves, the first one, and the second one, which is an interactive website that has a lot of information, including policy briefs, including blogs, and all kinds of interesting information, which I would invite everyone to have a look at and give us feedback on. And with that, I hand it back over to you, Ok.
Yeah, thank you very much, Erica. This was very helpful. Thank you very much. Let's give her an applause. That went very well, Erica. I'm going to deviate a little bit from the program here in view of the time difference, Erica. We don't want to keep you too long in Geneva, although the time difference at the moment is only 5 hours rather than 6. Yeah. So I think I would like to just open the floor for 5 minutes for any questions or observations or demands, requests for clarifications. Before we get to the overall question and answer session. So if there are any observations, any questions that pertain directly to Erica Wheeler's presentation, the floor is open. I see nobody. No? You see anyone? Yes, please, go ahead. If you could introduce
Yes.
yourself for a second.
Hi, I'm Tamia Fafori, USAID. One of the questions I had, Erica, was about your recommendation of looking at school recruitment policies. So what do you recommend be done for countries that have a centralized process for application, especially for medical schools?
Go ahead, Erica.
Okay. Sorry, I missed your name, but I know you're from USAID because I heard that bit of it. I have only just started working with UNESCO, looking at the whole area of secondary to tertiary school education and changes in the curriculum. So I would not be so bold at this point as to make a generalized recommendation on that, because I think there is so much that needs to be dug out in terms of, how do we view who is suitable for entry, for example, into medical education. I was at a conference with the International Federation of Medical Students Association just a couple of weeks ago, and it was very clear to me and in my discussions with them that one of the things we are missing out on very much is that we concentrate so much on looking at qualifications only. We forget that there are other competencies that are needed to make high-quality health professionals. So it's something that we are looking at, and we want to get more of the evidence for so that we can reach the stage where we can put out a policy brief, and eventually when we revise the guidelines in 3 years' time, we can say something more substantive about it. But at this point in time, I wouldn't want to jump the gun.
Thank you very much, Erica. Any other questions? Yes, please. Go ahead.
So I said, my name is Therese. I'm with Global Health Support Services. Erica, you mentioned something about faculty development, and I know it's a big problem in developing countries. So what are you doing to recruit, develop, and retain, qualified faculty who will be responsible for educating, the rest of the healthcare workers? I'm talking about, for instance, in medical school or nursing schools or things of that nature.
Okay, so about recruitment and retention, what is WHO doing to promote recruitment and retention?
Right.
Yes. Okay. One of the things that came out very much out of the discussion or the guidelines on access to health workers in remote and rural areas is that we need to be looking at recruiting more from the population which is going to be served, okay? So what you have to understand is this: WHO doesn't actually do training, but what we do is we promote policies and we work with governments in order for governments to change the way they train or recruit their health workers. So the recommendations that we made, some of the best evidence comes out of recruiting locally, especially like in a rural or remote area. The likelihood of people remaining there when you recruit locally is much higher. So it is about encouraging government and also talking about what incentives could be given, and incentives are context specific. I have lived in other places, and I know sometimes even if you offer a doctor $500 more, he might only remain 6 months in a rural area. So we've made recommendations about recruiting locally. We've made recommendations about making sure that there are clinical rotations in rural areas so that people understand the needs of people in rural and remote areas, for example. On the issue of incentives, that's a bit more tricky because we have to look at what is affordable in the local context. What is feasible. There's something called discrete choice experiments that have come out of the guidelines on retention of health workers in remote and rural areas, and it shows if, for example, you give $50 or $100 more, what is the likelihood of a nurse or midwife remaining in a rural area. There have been suggestions about how long someone must remain in a rural or remote area. So there are policies about that. I know in Rwanda, they've got bonding policies that work, but they may not work in another part of the world. So what we do, and continuing professional development, we've actually just done a systematic review to look at how do we encourage health workers in remote and rural areas to actually continue their professional development without feeling that they're losing out and leaving those areas to come to the city. So we have recommended a number of areas, and we are gathering information. I think the last couple of days here, there's been a meeting looking at what is the evidence about what is working in different parts of the world. So we are building up a database of evidence about what works in which parts of the world. But we have given these recommendations, and we are tracking how it's working in some parts of the world. But all of these things that I just mentioned, recruiting locally, having health professional schools outside major cities, clinical rotations, curricula that address rural health issues, all of those things exist. So I'm not saying they don't exist, but it is about tracking and recording what is effective where, in which context, because we cannot assume that one size fits all.
Thank you very much, Erica, and I'm sure we will get back to the issue of faculty also during the overall question and answer session.